I did my course in Spain, okay, at IMAC, and I met this guy, and he said
it's not something that we can totally ignore, but it does make a huge difference.
The idea was to close them up and, make sure that they were not bleeding and the baby is fine.
People think that some of these treatments are painful.
I think people confuse plastic surgery with aesthetics. And you want to go from 60 to 30 in 30 minutes. Hello and welcome back to another episode of Health and Life, and today we're talking to somebody who I've known for a really long time, and she's called Sakina. I feel like she does a lot of things in her life. She writes, she has content, she bakes, she constantly upgrades her education, and she's very interested in the world. And so I think it was a natural choice to have her as a curious person to ask these questions that she has. And today she just wants to know a little bit about aesthetics.
Hi, Shikha.
Hi.
So nice to meet you today.
All right, great. We've been planning this for a long time, but it's finally happening.
Yeah,
so, go on. Shoot.
Okay, so the first question for me, and I think a lot of people would want to know, I don't know if people know about your background as a professional, but I know you for like 10 years now, maybe?
Maybe 10 plus.
Yeah, okay. So I've seen your journey grow as from starting from in emergency ICU taking care of ICU patients in Bugando to now being an aesthetician over here and having your own clinic. So how has that shift been from dealing with something so serious to now,
Oh yeah. Okay, so now that you mention it, I didn't even realize that I've moved or the journey has been so real. I do still deal with the emergencies, not maybe in ICU, but I do deal with emergencies. But I feel like now those emergencies look larger when I think about it. Aesthetics actually came a little naturally. I was growing older, and I was looking in the mirror every day, and I was like, good Lord, what can I do to make myself feel a little better? Because, with time, you just keep growing older and older, and your skin actually shows that. Sounds superficial, but it is a cause for concern, I feel like, for a lot of people.
I think it's a real problem.
Yeah? So, to be honest, I started with somebody who didn't care what moisturizer they were using, what kind of cleanser they were using, and then there I was, moving from 35, going on to my 40s, and I was like, we need to do something. And I tried everything that was viral or trending.
Yeah.
And this product was trending, so I tried that. And then there was another product. And then, there was the one that changed my life was a midnight serum.
Oh, wow.
So it said, use at 12 o'clock. And I would wake up in the middle of the night. And honestly, I don't put that much effort into a lot of things. But I was waking up at midnight and applying the serum. And then after 2 weeks, I was like, not sleeping really well, dark circles. I was like, oh my God, what am I doing to myself? Threw that in the bin, and I was like, I need to learn more. So I had a conversation with a friend of mine in the States. We were working together at some point, and she said, all of us are moving to aesthetics. Well, why don't you try it? So I started reading about it, and then COVID hit, and everything was online. So it gave me the opportunity to learn a lot during that period of time. That's been the sort of...
So it's your journey learning something more for yourself and then adding that to your professional bucket as well.
Yeah, so now I get a lot of pleasure in getting somebody to feel more youthful or more beautiful because, to be honest, when you're doing medicine, we're taught to save life.
That's true.
We are more concerned about mortality. And we don't really think about how this person is going to go out there in the world and live. We just want to save that life. But sometimes that's not enough. I remember when I was just doing my OBGYN rotation, we used to do emergency C-sections and, to have a cut like this long on abdomens for women to do an emergency C-section. And then, we would suture it. The idea was to close them up and, make sure that they were not bleeding and the baby is fine. But then we never thought, what if she wanted to go to the beach?
Yeah.
And, what is she going to feel about her body when she's taking a shower? That was never a concern. So I feel like medicine has also grown a little bit, and we're not just talking about life in the usual sense. It's not about just, just live, breathe. It's about living fulfillingly and living with yourself, liking what you see in the
That's
mirror.
true.
It might
Yeah.
not be about other people, but it's about what you feel and what you see.
I think that's also a very noble thing to think about.
I don't know, it could be vain, but
It's
yeah.
vain, but also noble, because when you think of it, it adds value to your life, doesn't it?
Yeah. So, like, honestly, before I would be like, it's just a pimple, live with it. But now, I mean, I've gone through that with hormonal changes, and when I see that pimple,
Yeah.
it really is upsetting. And when you go out there and you're talking to somebody, you feel the other person might not even see that
I
pimple,
know.
but
Yeah.
you're feeling like that person is only focusing on that pimple. So that
That's
becomes
true,
such
yeah.
a big thing in your life, and confidence and a lot of other things suffer because of that. And I think a lot of people, especially in the corporate world, whether it's female or male, nowadays even teenagers, like my son was wanting to have a haircut, and he was like, "Mommy, this is my identity." And that was a rude shock. I was like, how can an identity be connected to hair or skin? But yeah, it is in the world we live in, and I think it's valid. We all judge people without knowing
That's
that we're
true.
judging people. When we see somebody well kept, we see somebody well put together, we automatically feel like we should listen to them, or at
I
least give
agree.
them a chance.
I agree. And I think like the way you look, it makes the first impression
Yeah.
to anybody you're meeting. So it's not something that we can totally ignore, but it does make a huge difference.
The reality of the situation is that
Yeah.
it makes a difference.
Yeah, it does make a
But
difference.
maybe as we grow older, society will get better and not judge you for how you look. Okay. And I feel like a lot of people put so much emphasis on like just a little wrinkle, or they're meant to happen. You will never look like you're 20. For that
That's
matter,
true.
you will never look like you were 13. As
Yeah.
you grow older,
Yeah.
your face changes. The expressions that you have on your face change you. If you smile a lot, you'll have maybe that's why they're called smile
Yeah, that's
lines,
for
or
sure.
expression lines. So I don't think you should worry about them.
Of course, yeah.
But yes, if it makes you feel a little less, or you want them to be a little less, then we can definitely help you to overcome those situations. But my own view is that shouldn't be your whole and soul.
Yeah.
We need to be like a complete human being, and not just the way we look, because where we are going with the material world, I mean, fast fashion is doing such a great job, and makeup is like, it's billions and billions of dollars invested in that. And that's because we as consumers are consuming it. So I think natural beauty, enhancing your own beauty and not looking for a specific thing, like if eyebrows that are trending, you can't just keep running after.
That's true,
every
yeah.
trend.
Cannot keep what is that one thing that you feel is like an instant gives anyone with like a instant glow in their appearance? Like one thing if you take care of, or maybe it's just the way they dress up or look, or anything that will make them look more put together.
So this is my own opinion, right? I feel like a good night's sleep,
Yeah.
and good nutrition,
Yeah.
and exercise,
Fitness,
and fitness. I think these three put together can make a world of a difference. So even before you walk into an aesthetic clinic, if these are the things you're doing, then you're already 10 steps ahead, because there is absolutely nothing we can do for a tired, battered body, because the skin is the largest organ in the body, and it is one of the most reactive. Whatever is going on inside, it shows on your face, right? Like,
That's true.
if you're shocked, you can see it on your face by your expression, or some people say you're pale, what's happened, or you're blushing, and then there's always that bridal glow, when you're with your loved one. So I feel like what you're feeling inside definitely shows on your skin. And before you walk into a clinic, if you've taken care of those three things, then you're definitely out for a better outcome.
Yeah.
So yeah, we don't perform We just enhance whatever you have, help you to achieve that skin. And I think if you're ready to do something about your skin, you've got to give it time, because this is all connected, it's all natural. You can't expect to go to a clinic and say, make me pretty. That's how people do it. Like, I'm going for an event in 2 hours. What can you do for me? Like, there are things you can do, but you cannot change a whole lot.
So overall, what's the difference between a dermatologist and an esthetician?
So that's a good question. Sometimes the lines are really blurred.
Yeah.
But a dermatologist is more medical issues of the skin, if I put it in layman's terms.
Okay.
So we're looking at things like psoriasis, eczema. They'll be curing it with medication.
Okay.
Whereas an esthetician's job, like word aesthetics means, is beautification. So it's basically enhancing, it's getting rid of those scars, those hyperpigmentation marks. Like I said, the lines are a bit blurred, so there are some things that cross over.
Okay.
But I think dermatologists also are looking for a better skin health. Like, they are treating medical conditions. So I'm a physician and an esthetician, which puts me, if a dermatologist was in the center, physician would be at the periphery on the right side, and the esthetician would be on the periphery on the left side. So I feel like I hug, the world of dermatology with my both hands. And I like to do that because, you understand what's happening inside, translate it to what's happening on the outside, and then give that person a better chance to look better just on the outside.
This is a very lame question, but you know how they say, like, a dentist is always looking at your teeth.
Yeah.
So as an esthetician, are you always like looking at people's skin?
So, I did my course in Spain, okay, at IMAC, and I met this guy, and he said, consider yourself a good esthetician when you randomly look at a person and say, she did this and she needs this, okay? I don't think I've reached that point, and I do look at people and say, wow, what amazing skin. And sometimes I do look like, I wish we could do like a little bit of filler here, or maybe a Botox would do really well there. So I do that, but I don't judge. I feel like I haven't really gotten to that point where I'm like, I have a friend in Nairobi, and he's been doing this for like, I think 10 odd years. And when he met me, he's like, your nose, we could make it like a little better. And I was like, not interested. But at that time, I didn't know that much about aesthetics. And I'm somebody who really believes in natural and true beauty.
Yeah.
So I was like, no thanks. But I understand what he meant now. But I don't randomly go up to people and say, I'd like to put some filler in your nose, or, that kind of thing. No, I don't do that. But I have started. I've become more aware of what somebody might be doing to achieve how they look. So I do kind of, so I went for a holiday and just sat at a cafe and watched people buzz by. And fortunately or unfortunately, it was in Dubai. And, in Dubai, you get, at some point, there's people from everywhere, and you could tell, like, somebody did a filler, or somebody did some Botox, or the face didn't match the overall body's look. So somehow, somewhere you've done it, something has been done. So it's nice.
You can tell.
I think if you can tell, the job was not like amazing. I feel like if you look at someone and say, what has she done, like, why is she looking a little different? That is a good esthetician's job. Like, that's the esthetician that I would like to be or go to myself.
What's the most common problem that people come to you with in terms of their skin or aesthetics?
I'd like to say, I think it's a competition between acne scars. So, acne is quite rampant. And I think in today's day and age, where everybody's eating a lot of junk food, acne is, it's there, and it leaves a lot of marks. So that, I would think, is like very, a significant number of patients come with that. And the other is just that the hunt for good skin. And I think a lot of the words that I hear are Korean glass skin. So a lot of people want smooth, no scars, good texture, good tone, yeah, that kind of thing. So yeah, that's basically the kind of people that we see a lot more than the others.
So what do you recommend someone who's just like starting to get to know the aesthetic world, like they want to do something about their skin, but they don't know where to start from?
So like I said, you could start with what's happening inside. So we're talking about good nutrition, exercise, and good sleep. Amazing job it does for your skin, but also good skincare routine. And I think skincare routine is the key word. So even if you have skincare, like, somebody sent me a photo and they were standing in their bathroom and I could see like the back of the bathroom and there was like a million products. And every time you open TikTok, you will see a new product. So now you have like foundation with niacinamide and you have, a lot of things. But I think the basic idea is a good cleanser, both morning and evening, a good moisturizer, depending on your skin, and a sunscreen in the morning. And I think if you have those three things, you're already like 70% into great skin.
So what the night routine will be just moisturizer and like a
cleanser. So like if you don't really know what's happening, then that's the best thing to do. Like, instead of like, I think another point would be if you're using too many things, you're probably doing it wrong.
Yeah.
Because there is absolutely no way. First of all, just remember that God made our skin as a barrier.
Yeah.
You will have to have very good stuff that actually penetrates the barrier. So one, the brand has to be amazing for you to make something that actually penetrates the barrier. And how much can penetrate the barrier? So, if you're putting 3 serums, like even like at intervals of 5 minutes, I don't know which one is going to work. And they might be interacting. So you could say this is niacinamide serum, but you don't know. They put niacinamide in it, they put retinol in it, they put, the basic ingredient could be niacinamide, but there could be a lot of other things in it that react with the other 5 things that you're putting on your face. So if you keep it simple, then you're doing it well. Without, like, if you've not gone to an aesthetician or a cosmetologist or a dermatologist, then if those are the 3 things you're using, then you're doing really good.
So imagine you're in a deserted island and you can only carry 3 of your
favorite products.
Yeah. So what would you take with you?
Wow. Okay, first let's start with my product line is not so amazing like the ones that I use. I'm better at giving people advice rather than using myself. But my favorite cleanser these days is a purifying mousse. So by the way, I'm very brand loyal.
Okay.
I love Miso aesthetic products.
Okay.
They're also Spanish products and I have a little bit of an inclination towards them. So it's purifying mousse by Miso Aesthetics. And the serum that's called AOX Ferulic. It's an anti-aging and I love it. And the moisturizer would be like Hydra Vital Light because it's so much hyaluronic acid and I love it, and a sunscreen. I love the Healace sunscreen that's from another brand. It's called Lamel and it's really nice and it's very protective. So those are, I think I'd have to go with like 3 bottles of sunscreen if I'm on an island. Yeah.
What is this one skincare myth that makes you cringe? People follow it a lot.
So I think I'm all for natural stuff, but I don't know, I guess with age you want things to move a little faster, and I cannot like wait for results, right? I like to use things that maybe do things a little faster. So this thing of I'm eating a tomato and then plastering them on my eyes, or cucumbers on my eyes, or like there's a few celebrities that will say whatever's on the table, like eggs, beer, and I don't know, whatever, just apply it on your hair. Yeah, that makes me feel a bit I mean, if it is organic, or something like that, I'd probably still say it's okay. But now I'm thinking, what is in the tomato, what sort of chemical was on the tomato, and I don't just turmeric, and I don't know, that haldi, and that kind of thing. I put it on my face. that makes me cringe. Like, I cannot do it. I'm all for natural stuff, but these days I don't trust anything natural as well. Like, where did it come from? Who did what to it? So yeah, that thing of just, yeah.
What's the biggest misconception that people have about aesthetic world?
Yeah. So I think people confuse plastic surgery with aesthetics. Because you come in and we tell you that we have a series of treatments that can give you a skin lift or that can make you look younger, and you want to go from 60 to 30 in 30 minutes. And I think that's a misconception.
Yeah.
Or like, I think we battle with that. Like, patient expectation is something that I battle with every day. These are also medications. It's not that, for me, every patient is important to me. And if I can do it to myself, then I can do it to you as well. And if it's my recommendation, it'll be for you and for everybody. But sometimes it works for you and doesn't work for the other person. It depends on how much collagen you have, how much connective tissue you have. And we all have to remember that aesthetics is based on the fact that your body is going to do the job. We are just triggering it. It's like you've sent your child to a good school, right? And you're doing tuitions. But then you're assuming that in class he's listening. So the tuition is just an add-on. It's like a trigger, not the whole school. I feel like plastic surgery is the one that gives you instant results. Even that is not that instant. I mean, think about hair transplant. It takes about 8 months to get your hair back or to see if it worked. And people want you to do one treatment and then get a full hair, head of hair, or your skin lifted in like a matter of seconds. So I think that's the misconception that I'll walk into the aesthetic clinic and my problems are going to go away like this. So I like to do that, but
no,
it's not really possible.
Do people think that some of these treatments are painful, or how does it really work for someone who's coming in for the first time? Do they expect pain or no?
Yeah, I think so. Like, we do peels, right? And when we withdraw the chemicals, they have to be a little sterile or whatever, and we withdraw them in syringes, right? So when we're going into the room with the syringe, they're like, oh my god, do you have to like inject me with that? So people do come with the expectation that there's going to be pain, there's going to be injections. There's no pain, there's no gain. You go to the gym, you got to work out, you will be sore. And sometimes aesthetic treatments could come with a little bit of pain, but it also depends on what's your pain threshold. But we try and do everything painless.
Okay.
It's not that painful. I'm thinking about it relatively, like, cutting through somebody's face and then, suturing it, and then post-op, you've got that pain and stuff like that. That doesn't exist in this the aesthetic world. It's all about doing it naturally, trying to do it pain-free, and keeping the patient comfortable. So I don't think there's a lot of pain involved.
That's good.
Yeah, but there are people, like, I was injecting somebody and I just touched her arm and she's like, I was like, the needle has not even come close to your body. So I think a few people just have this expectation of pain, but it's really not. It's not painful.
So, talking about your own journey with skincare and all of that, is there any advice that you would give to yourself like 10-15 years back?
Yeah, for sure. I'd be like, darling, you need to use good sunscreen and at least moisturize your face. I feel like my skin could have been a little better if I was using at least the basic 3 blocks of cleanser, moisturizer, and sunscreen. And I feel like I was a bit late, but I feel like better late than never.
Great.
So if anybody out there is looking for something, then cleanser, moisturizer, sunscreen. If there's anything you can take away from this podcast, it's just that. Just those 3 bricks, and then whatever you add to it is just bonuses. But I would like to have told myself I could have at least stuck to a moisturizer and not just, whatever, just plaster it on your face. Or not even, sometimes I would be just on the beach. No moisturizer, no sunscreen. But yeah, that's the beauty of being youthful. You know, your skin adapts so quickly, your body repairs everything so well. That's why you start realizing all these things when you start hitting, the 30s and coming towards your 40s. At 40, it's amazing. But I also think at 40 you have a lot of time to look at yourself. But at 40, that that decade is where you feel like you're just growing older every second. Like, you'll see a photo and you'll say, oh my God, I look so horrible. But if you see it 2 months later, you're like, oh my God, I look so good on that, and I look young. So, yeah.
So, about Arcane Health, what are your goals for the next 2-3 years?
That's a good question. I've been thinking about that. I want to contour faces. I don't want to do the everyday fillers, the normal, let's do fillers for the laugh lines, or I just want to look at somebody's face and do a job specifically for them. So, like, I look at you, I don't want to, like, just let's remove the laughter lines, or we have proportions, like, when you do a side profile, there are proportions we follow. I don't want to follow proportions. I just want to make faces more beautiful. I went for a conference, and I met this French esthetician, and he showed us pictures of this lady who came to him and said, I just look, you know um, stern every time. I want to look loving. And she was a teacher. She was teaching, ages of 4 to 5. And she said, I just want to look pleasant. Kids get scared of me. What's wrong with my face? And he looked at her, and she had a little bit of tightening, and he did a little bit of softening of her features, and he did a little bit of Botox, a little bit of filler, not much. But when you look at the before and after pictures, you actually see the warmth exuding from her.
Yeah.
And that's what I want to do. I want to do it like a piece of art, and not just basic science, 3 3 3, or fill here 1 ml, fill here 1 ml. No, I want to contour faces. Like, that's what I want to do in the next 2 to 3 years. I don't know if I get a chance to do that, but that's at least what I'm aiming to do.
Yeah. Do you think, like, what you just spoke about, how our faces get, these wrinkles and all cause of expressions, and how we like tighten our face, or maybe we're like always like angry, or we have this particular expression. So does that really make a difference, or it's just like how some people are, that's the way they look, or it's more to do with how they keep their faces or their jaws always clenched? So is there like some kind of exercises, like relaxing things that we could do?
I think there is a lot of expressions that we do just naturally. If I tell you about them, then you will be conscious about them and not do it. Like, I try not to do this anymore. Or, like, when you're lifting weights in the gym, and you're like, and so now, like, I'm not really doing that. I'm like, because I don't want those facial expressions. So, our skin is just like the surface, and our muscles are below that surface. And whatever our muscles do, our skin is going to mimic that. So it's true, if you change your expressions, I'm not saying don't laugh, or don't laugh heartily, but there are some things that, especially forehead creases, that you can, minimize by just softening your expressions, or not always angry. There are a lot of men that come with one facial, like, forehead lines, and especially the 11s. We call them 11 because they're always like, or like when you're concentrating, you do that. If I tell you consciously, you will actually reduce them. If I tell you that's your problem, then you will actually consciously be doing this. Now, I have a friend who I told her, don't do, you'll get the 11s very soon, and now she keeps doing this. That's a bit much, but yeah, if I tell you, or I point it out to you, you will make a change, and it will, progressively make those expression lines less. But I feel like expression lines are who we are.
Yeah.
Even if you do go for things like Botox to reduce them, don't eliminate them, because
Yeah.
that's what makes our faces unique. Those
That's
are the
true.
expressions. They show how wise you are. Like, as you grow
Yeah.
older, you don't want people to think you're 20 and in that state of mind of 20. You
Yeah.
also want a little bit of your age to show. I mean, if you're in a place of work, you want your experience to shine out. You know that experience should also show on your face, and it
That's
does.
true.
And that's
Yeah.
why God has made those expressions, so that, but we can't just take it, like, you don't have to have those sunken in expressions. We can lighten them or soften them and
Yeah.
just make you feel a little better about them. But if you're 80, I think you should look about 70 or 65, but it doesn't mean I need to just like erase all expression lines. It doesn't even look natural. I
Yeah,
feel
that's
like
true.
natural is better. So reduce them, soften them. That's the kind of thing I would prefer. But that's just my preference. Aesthetics is also the beauty that lies in the eye of the beholder.
Yeah.
It's what I feel that looks beautiful. Some people like puffy faces. I like more slimmer,
Yeah.
like well-defined jaws, and so I don't do a lot of fillers everywhere. I like it to be more natural movement. So when you put fillers, that area, nowadays we have good fillers, but previously there were fillers that would just make your face look, like just expressionless. And I think that's what people think fillers and Botox is all about, that I will never have expressions on my face. But that's not true. They're dynamic fillers, and we can just use the Botox to soften it a little. It doesn't have to be zero. Like, you don't have any wrinkles. So in time, we could just soften them, or if they're coming up, you could prevent them from making those large, indentations in your face.
Right. And so when it comes to doing like Botox and fillers, they have like a maintenance phase as well, right?
Yeah, so Botox does. Depending on the type of Botox you use, you gotta repeat about every 3 to 4 months, depending
Okay.
on whether you're really active. So if you're like an avid gym goer, it's going to be it'll wear off faster.
Okay.
But fillers are like about 2 to 5 years. They don't need a lot of maintenance, depending on what kind of fillers you use.
Oh, so they can stay for that long.
Yeah.
Oh, wow.
You'll see on social media, there's a meme going around. There's like a skeleton, and you can see all the fillers are still there and everything else is gone. So yeah, fillers can stay for really, really long.
Okay, wow, that's interesting.
Yeah, but so for fillers, the maintenance is actually, so today you fill this, then the rest of your face starts aging. Then tomorrow you'll want to fill this area, like this looks young, and then this is not looking that young. So you're naturally going to be going for more and more fillers, because you've not allowed it to age so much. That's why these days people are going for something called Sculptra, and basically biostimulators or biomodulators. So when you inject them, the body produces collagen and connective tissue in that area. So it might take about 3 months to give you that filled up effect, but it's more natural, which means that your entire face is going to age at the same rate.
Oh, that's very interesting.
Yeah, so right now everybody is moving towards doing that kind of stuff, because even estheticians are like, now how much more filler am I going to do? Sometimes you put the filler in and then there's no space to put the filler in. Plus when you touch your face, it's like hard as rock sometimes, depending on the sort of fillers you do.
Yeah.
So now people are moving from light fillers, like the ones that stay for maybe 1 or 2 years, and biostimulators and bio remodeling is now what is trending, because you want to do it more naturally. People are going towards spend a little more time, but do something that will give your face a little bit more natural look, and your face will age better. So I think that's another area that can be looked at. Unfortunately, you come to an aesthetic clinic and you're already like, I want this changed now. So I don't have 3 months to, like wait for it to work, and I just have to do something there and then. But if you find a middle ground, then it works really well. So you do a little bit of this, a little bit of that, and a lot of biostimulation, and I think that works really well.
What treatment do you recommend someone who is not here for like fillers or Botox or any of that, but just wants like skin maintenance or,
Yeah, I think if you're, crossing or you're at the age of 30, first let's be honest, we start, although aging depends on what race, what ethnic background, what sort of gene pool you come from. Um, Post 25, we're all sort of aging at some point or the other. And if we start regulating our skin or doing constant maintenance, then at 50 and 60, you're not going to be looking at that emergency filler. You're just going to be, you've started your journey, you're continuing it. So I prefer to do like, things like hydrofacials, do them every 2 months. It cleans your pores, it gives your skin that fresh breath, and gets your remodeling started. So do these hydrofacials to maintain your skin. Then we have peels as well, maybe do them once every 6 months. There's some called retiflash that just hydrates your skin and just gives it that new look. So I feel like if you do these things every so often, like maybe once or twice a year, starting at the age of like maybe 28 going upwards, before 35, I think by the time you're hitting 40, you're just looking young anyway. You don't look like you're aging, so your clock is ticking backwards instead of ticking forward. Those are the patients that I really like to work with, because they might not know what they are not going to achieve, like at the age of 40 you're like, okay, I can see the difference, but at 30 you're preventing that 40-45 look. So I think that's better. Maybe twice a year at least, or maybe depending on your skin as well. So if you've got acne, you need to be a little more aggressive. Do it every 2 months. Check your skin, because you might overuse products and your skin is like, oh, it's oily, and you're always like, it's oily, but skin is not static, it's dynamic. Today it's oily, tomorrow it's dry. So you need to do these checks with also your products. Come in, look at if the product is right for you, do a maintenance, and then you go ahead. I think that's better.
And what's the usual process like? For example, I'm coming in for the first time and I don't know anything about my skin. I just know like I've been using this moisturizer for like 5 years and it's been doing well. Now I want to get like, get into that maintenance phase, like you mentioned, like one of those facials. So I'm here to speak to you. How does it, is it like a one day, like just meet up and okay, let's get going with the facial or whatever it is that you recommend, or is it like consultancy and then come again, or how do you usually do it?
So, well, it depends on you as well, but we look, feel, see, right? We have machines to see what your skin is like, but I mean, sometimes it's not very difficult to see, because we've seen so many skin types that we can, tell your combination, you're saying, oily, you're dry. But we also have very smart AI run cameras that pick up these things and tell you if you're aging. Are you aging very well? Are your pores clogged? Because that you can't see with naked eyes. So we do that basic consultation, see what your skin requires, build up a treatment plan for you there and then it depends on you. You can do it immediately, you can think about it, or procrastinate a little bit and come back later. But yeah, one shot, we check what's wrong, we look at it and build a plan, and that's it.
That sounds good.
Yeah, so I think the point is just to enter. Once you enter, then you leave it to us. I always tell them, let me be the driver, you be the passenger. Just tell me your destination and it'll be my job to take you, whether there's 4 stops or 5 stops. In the middle, if you're hungry, you let me know. But yeah, then you allow me to build a plan for you, customized, and then we take you from there. Now that we've talked so much, and you can see I talk a lot, what did you think about aesthetics before you came in and had this conversation with me? And what are you taking back home? So if somebody asks you out there what aesthetics is, or what is your view now?
Yeah, well, to be honest, I've never been into like all these things, I've just been just really minding my own little skincare routine at home, doing the moisturizer, just, sticking with the basics, as you said, like sunscreen and moisturizer at night. And that's it. So I've not known much about the aesthetic world. And we met like a month or something before, and that's when we spoke about it last time. So now it's like more in-depth knowledge about it. And it just makes me realize that it's not like, it's very natural what you're doing over here. It's just like playing with your own skin and helping it in ways which is not like totally distorting the way your natural look is, but just like really helping it renew itself and, like make it look better in smaller ways, not like really transforming it overnight, which I think is really good, because I also believe in like natural beauty over like plastic surgery or anything else.
Yeah.
So yeah, that was like a misconception in my head as well, that yeah, you will be transformed if you like it's all these different things like putting chemicals in your body and yada yada yada, which like a lot of people like me would be like, do I really want to do that? But I feel like a little bit more convinced that I want to come back.
Oh wow, that's nice.
Yeah.
So have you looked at people or like celebrities in general? You don't have to name the celebrities, but wondered what they've done, or like said this doesn't look good, or like have you like seen any of these and said I don't want to do that, or like I don't want to be like that?
I think what I have seen is like really drastic transformation, like for some of the celebrities, when they like really minimize their aging, or when it looks like very obvious that they are trying to like hinder that process of natural aging. You could see those fillers very well, or like they're not able to give those expressions so much because there's just too much on their face. So I think at one point it becomes very obvious when you see that. But yeah, I think with female celebrities, I think it's more more visible, or I think it's just like the expectations from female that you just cannot age the natural way, which is kind of really sad.
Yeah, but I think we should all age. We are going to age, but we should do it as a fine wine.
Yeah.
And not look haggard in the process. So I think, I really want to do a lot of, you said, what else do I see myself doing in these 2-3 years? And apart from sculpting, it's regenerative medicine. So basically the fountain of youth, or aging. And there's so much studies going on with that. So just find a natural way to stop the aging or to make you feel more youthful without doing horrendous things. And I think it's more of those celebrities that are a bit older, because they never had a chance to do all these aesthetic things. You'll see the younger ones are looking more natural. The younger ones are doing a few things, but you can't really put your finger on it. You see them, but you can't really say what exactly they've done.
Yeah.
But I think for the older ones, because it's been like such a drastic exposure, like, what can we do for you anyway, kind of thing. So yeah,
I kind of like that you are on your own journey to on your own journey to recognizing what works for you, as well as like helping other people, which is kind of like a very instinctive way of doing your profession, switching from what you were doing at first in the medicine field to like this, because that's what your heart showed you that you wanted. And I really love that.
I sometimes people don't like that, but yeah, I like the fact that you like it. It's like such two different like parallel worlds, but yeah, I feel like they're both me, so I want to do both. And I think if you're my husband always says being passionate about something doesn't mean that's going to be your career goal.
Yeah.
But from where I stand, if I'm not passionate about it, then I'm not going to be able to do it. So I think there has to be a mix between consistency and passion, and then working towards a goal. Sometimes passion makes you very tired, but if you're consistent and you've got that discipline, then maybe you'll get somewhere. So I hope if you come here again in 2 years, you'll see maybe something different, or at least experience something different.
Yeah, always finding new things to add on.
Yeah, like you like learning how to bake, and you're like a writer and a content creator, and you wear so many hats.
But sometimes it's easy to like lose focus,
Yeah, that's true.
So when you say like just moving in that same direction but being passionate, that means you're including different things into that. So which I think is like a really good balance.
That's nice. I never thought of it like that. It's good to have a different view of what you're doing. Sometimes you get bogged down and like, you're like, is it okay? Is it working? Sometimes you don't know whether your thoughts itself are actually correct or true. But it's nice to meet people who actually maybe, sometimes what it is. Like, it's daytime. But for somebody else to say it's daytime, but it's also sunny and it's a beautiful day, it makes a difference. So I'm glad we had this conversation. So at least we'll see you doing maybe 1 or 2 treatments. Yeah. We'll manage to lay you down on that table. They say once you lay down, you cannot forget it and you'll keep coming for more. So we'll keep you coming back for more and more natural stuff. And that is all from Health and Life. If you have any questions, please let us know. If there is anything else you want us to focus on, please let us know. Call us, message us, DM us. We are happy to answer any questions. We'll see you next episode.